So today I have the privilege of getting an acupuncture treatment from Rachel, and so that you can see a very simple, basic technique of this type of treatment.
I'm looking forward to it.
Great, me too.
Okay, so now I'm lying down on Rachel's treatment table, and we're about ready to do a little cosmetic acupuncture, so get a little demonstration.
Great. So I'm just going to do a couple points. So we're just doing a very brief demonstration today so people can get an idea of what it looks like. So when I do the face, I cleanse the area.
So I'm feeling a little anxious.
Are you?
A little bit.
Okay. Yeah, you've had this protocol before. Okay.
It's been a while.
Yeah. Get everything ready over here. We won't do that. It'll be so easy. Okay. So I'm just going to use a little of the cleanser here to clean the area.
Smells good, whatever you're using.
This is a frankincense toner,
Nice.
which I love. Okay, Christine. Start with some needles. It's okay?
That's fine. Hardly
Great.
had anything.
Great. And so the needles sometimes they slip out because we do them so superficially, like this one just fell out. Because they're just barely in the skin. Because we're working with the energy just on the surface of the skin where the wrinkles are. So we go right into these little points right here. You okay?
Mm-hmm.
Are these hurting at all?
No, hardly at all. Just barely a little pinch.
Good. Okay.
And she's fast, which is even better.
Yeah, get it over with quick, right?
Mm-hmm. Yeah, the nice thing to look forward to is the results. So.
Yeah. Should really work well on you. You're already getting a nice pinkness around. I don't know if you can see that on the video, but that is called, in Japanese we call that hoseki, and that means that chi has arrived to the area.
Good.
So lifting's already happening.
So my chi is good.
Yep, your chi is good. Everything's already lifting.
Yay.
Which Christine has been through this protocol before, so we should actually notice some kind of difference within 24 hours after her visit today. These okay?
Yeah, feels good. It's not nearly as intense as I thought it was going to be.
Right. You've had a lot of practice. Okay. So this is just a demonstration of the points just in the upper part of the face. A normal treatment we would do all through her jawline and her cheeks and around her nose. But just for purposes of demonstration today, we're just going to work on her lids and her eyes. And maybe tomorrow we could check in with Christine and look at her and see if we notice any difference.
Nice.
So I'm just going to let you rest here for a few minutes.
Sounds good. So I can definitely feel some tightening effects going on. So even though these needles have only been in for a few minutes, already feeling some changes going on around the eye area for sure. Definitely some tightening effects, and it's not intense at all. Not like what you would think. So it actually feels pretty good. It's kind of rejuvenating.
Great.
So Rachel is checking my pulses now, and can you just describe what you're doing and why you're doing it
Sure.
at this point?
Sure. I'm feeling your pulses. And everyone at home, if they'd like, you can take your right hand and then take your left hand and wrap it around. And you can find three different positions on your wrist, and just you can feel your radial pulse. And if you just sit there for a few minutes, press deeply and then lift up. And you can feel under 1, 2, 3 different positions on your wrist. You actually can feel 3 different sensations of your pulse. Then you can take your left hand, wrap your right hand around, and feel 1, 2, 3 positions. And you'll actually feel 3 different sensations. And on either side, those 3 different positions at 3 different depths, light, deep, very deep, correspond to different meridian systems in the body. So that's what I'm feeling on Christine. 1, 2, 3 positions here. And then on the other wrist, I was feeling 3 different positions that corresponded to different meridians. Now I'm going to feel her abdomen. Is it okay if I do that?
Mm-hmm.
Okay, great. When I do abdominal diagnosis, I'm feeling for temperature differences in places where there might be pain. So here I feel a little cool spot right here. So I'd actually like to do some moxa. Does that sound good? Good.
So what is moxa?
So moxa is is a Japanese style, more Japanese style than Chinese style of acupuncture. Uses a little mossy substance called moxa, made from an herb called Artemisia vulgaris. It's very spongy. And what we do with the moxa is burn it directly on your body, and it helps to add some chi into your system, is the most rudimentary description of what I'm doing. So what we do is we make a little cone out of the moxa, which I can show the viewers like that. And we light an incense stick, and we touch the tip of the incense to the tip of the cone, and the cone starts to smolder. Let's see if I can get this so you can see it. And then we take it off before it has a chance to burn the skin.
Yeah, I could barely feel that.
And so this helps to add energy into the system. They've done Western research with moxibustion, we call it moxa or moxibustion, on a group of patients after chemotherapy. And chemotherapy really wipes out the white blood cells in the body and the platelets. And what we like to do after chemotherapy is build that up in the patient. And there's a group that had direct moxa or direct moxibustion, which is what I'm doing here to Christine today, or they had none. And the group that had the direct moxa, their white blood cell count increased 50% faster.
Wow, that's pretty impressive.
Yeah. So that's one thing we were able to study with Western science for the old Chinese medicine. And the moxibustion leaves a little yellow stain on the skin, which is the oil, which is very therapeutic to leave on.
So moxibustion, it's also, the material is mugwort, correct?
Yes. From the plant mugwort. And we're looking for that little pink area to start developing like we saw on the points on Christine's eyebrows. We're looking for that same pinkness to happen through this point.
How are we doing? We're getting there.
Slowly but surely.
So my meridian in my tummy areas is a little
Maybe a little weak,
weak.
but we're boosting it up. This has to do with the kidney area. And the kidney meridian is the energy associated, I like to call it our money in the bank. So when we're born with a bunch of chi and energy that we can dip into. It's kind of like our second wind.
Mm-hmm.
If you're familiar, you're really tired, and then all of a sudden you have a big burst of energy. We get that from our the kidney energy.
Really?
And as we age, we've kind of dipped into that quite a bit. And what we like to do is build that up in our patients that are over 35.
That would mean me.
Yeah.
That would qualify for me.
Yeah. Also, people that have had significant illness or trauma, this point will be very cool as well. And if you notice now, it's nice and pink.
Nice.
So that's good.
So this technique is very, very relaxing, I have to say.
You just stay relaxed. Yeah, a little bit longer. Okay, so Christine's been laying here for 20 minutes relaxing, and we're going to go ahead and I'm going to take out the needles right now. Start right here. Go nice and slowly.
I can't feel these needles at all.
So a lot of people ask me about the needles, and they are single use and disposable. So when the needle goes in, it's in a sterile wrapping, and we put it in your skin, and then when we take it out, we put it in a sharps container that goes to a biohazard landfill. Doing okay with these?
Doing great.
How do you feel?
I feel really good. I really feel like my skin's really tightened up around the eye area for sure. I definitely feel a difference.
Good. So what I'm going to put on now is a little arnica gel that will help clean the area a little more after the needle's out in case there was any micro bleeding and prevent any bruising from happening, which can happen. Before people come for the protocol, if they're on any kind of aspirin or any kind of blood thinners, we ask that if they can safely go off them for the protocol, we ask they go off those 1 week before they start.
For the 5-week treatment.
For the 5-week treatment, and then they can go on it after. Go back.
I can see my eyebrows, and they definitely look like they're raised already.
You can see it in the monitor?
I can totally see it.
Yeah, that's cool. We'll be able to look, too.
Wow. I mean, it's amazing. I definitely can see that lift. Yay.
Well, let me put a little oil. So I also recommend wabi-sabi oil, which is a formulation of Chinese herbs that really help with the skin. And it's just a very small amount of oil that I like to rub on.
Smells good too.
This is the just rewards after going through all those needles.
It's like getting a little mini facelift. Feels really good. Smells really good.
Yeah, I do see more of an arch here in your brow.
Yeah, totally.
Already, which is great.
I really see that lift.
Great.
Pretty amazing. Not bad for 20 minutes.
All right. Thank you very much.
So, we are going to finish up our interview with Rachel Rose. Thank you so much, Rachel, for your time and energy and everything today. It was awesome. Looking forward to seeing you again soon.
Great. Thank you for coming. It was great seeing you and being able to demonstrate this procedure today.
Thanks.